And these are a little different because instead of just having, you know, the holes where you can press the button, it actually has the height. So you have some that, this one is like 5'2" to 5'10", 5'2" to 5'10", okay? 5'2" to 5'10". But you also have some that are 5'10" to like 6'4". Or you have crutches that are for pediatric patients, okay? So you need to make sure that you pick up the correct crutches for your patient. Let me put this here. Now, you'll see a lot of people on this, right? Who should be on these crutches? People who have good balance, maybe younger, and those who can really tolerate a lot of weight, okay, on this hand grip. Sometimes you'll see they'll cushion the hand grips, or they'll cushion underneath where the arm pads are, because if not, you can press that nerve and cause nerve damage. You'll see the same thing. Sometimes you'll see with the four-leg walker, they'll put you know, more cushion here. Sometimes you'll see they'll cut a tennis ball because they don't want it, they want to drag it instead of pick it up. Well, the point of that is actually to do what? Really get a four-wheel walker or two-wheel walker. But sometimes they'll do that because they're not walking with it properly, so that they're dragging it. And that's because the rubber will wear out, but you can replace the pieces, okay? So they can also replace those pieces, but you'll see them do that. Now, with crutches, again, it usually should be for people who are younger, who have good balance who have good balance. The first thing I want to do, just like I did before, is I want to measure, instead of the wrist, this time we measure to the armpit first, not the wrist, okay? The wrist is going to come afterwards, but the armpit is first. So, as you can see here, it's not too bad. I have 3 fingers. You should have at least 2 to 3 fingers that you're going to put under the patient's arm, okay? 2 to 3 fingers. And that means that I have enough room that when I'm leaning, hopefully I won't cause too much irritation or pressing or compression of the nerve, okay? The second thing I'm going to do is now I'm going to measure according to my wrist, okay? Measure according to the wrist. And so I may need to adjust this. As you can see, I'm a little, it's a little too low for me. So I need to raise it. So this one says 5'5". Now you can ask your patient how tall are you, but this is not really accurate. So I'm going to put it at 5'4", because I believe 5'3" is going to be a little too short for me. Nope, 5'3" looks like what it is. Oh, I'm 5'2"? No, say it isn't so. All right, let me put it back to 5. No, let me keep it at 5. Because what I really want is this. Okay. All right, that's good. Now, I'm going to adjust this. So we just take this wing nut off. Hopefully it won't come apart too bad and won't give me too many problems. Move this up a little bit. That's pretty good. Alright, we're good, okay? I broke my ankle about, I don't know, maybe now 4 years ago, almost 4 years ago. And I didn't realize I broke it. I thought, when I heard that pop, you know, of course you go in denial, oh, it was just my tendon moving. it wasn't really the bone cracking, because I'd never broken a bone before. And I went to the urgent care, and they took x-rays. They said they couldn't see anything. That's because at that time it was probably just a fracture, and you can't always see a fracture on x-ray immediately. It takes usually 10 to 14 days for you to be able to see a fracture. You can see a break, a clean break, pretty quickly. So they said, we're going to treat it as if it's broken, and they put me in an air cast, a little small air cast, and they said, okay, be on your way. I can't put any weight on this. Oh, and it was also kind of wet outside. I'm not putting my sock feet on the ground. I can't put my foot in a shoe because my ankle's swollen, and so forth. So they said, okay, here you go. This way. There you go. And they gave me crutches. Asked me how tall I was. They didn't adjust the handles. They didn't check to make sure that, you know, I wasn't going to, you know, compress the nerve. None of that. Just here, give you crutches, and out the door you go. Now, one thing is they should have asked me, have you ever used crutches before? What are your balance issues? Because I would have told them, I have vertigo. So I'm probably not the person you want to give this to, which I really experienced shortly thereafter. Let me tighten this up a little bit. And also, they didn't show me and demonstrate how to use the crutches before I walked out the door. Nor did they measure, again, my armpit or my wrist. On that day, it just so happened that I was visiting a friend in the hospital, and where I parked, because I didn't have a handicap sticker, I parked way on the other side because that's the only place, and walked with the crutches to the front door, and I thought I was going to die. I mean, I was wobbling, and I'm like, and a couple people walking around, they were like, are you okay? And I'm like, yeah, no, you know, because I'm walking like, I had never walked with crutches because I'd never broken anything. I'd sprained ankles, but I'd never walked on crutches. So you really need to talk to your patients and ask them some, you know, probing questions before you give them something, or have the physician give them something where they can actually hurt themselves, because I almost did hurt myself. So again, this is for somebody who has, you know, who has better balance, and is usually younger. Now with your crutches, the thing that you want to do, just like with the other devices, is that you want to move your crutches first, okay, not too far out, but your crutches first, and then your affected leg goes with it, because again, it's working in unison, basically taking the place of the affected leg. So you would go affected leg, and you kind of swing your, take your crutches and then swing your affected leg through, and then you're not affected. Crutches, affected leg, not affected. Crutches, affected leg, not affected, okay? And that's how you're gonna ambulate, okay? Or you could have somebody do this. They can walk, this would be what? Partial weight bearing, or put a little bit more weight bearing is tolerated, okay? Now what if I had one crutch? What if I had one crutch? I would put it on the non-affected side, right? So that I can walk with the crutch and the affected side together, okay? When we are going from a seated to standing to ambulating position, I'm going to sit back like this and have both my crutches here. I usually put them together, and then I'm going to stand up. Again, I'm gonna show you how I'm gonna do it as non-weight bearing. Non-weight bearing. Then I'm going to move one crutch to the other side, and I'm going to start to walk, okay? All right? Now, what if I'm sitting down, okay? And what I'm going to do is I'm going to go towards my seat, turn around like this. I'm going to back up until I feel my leg touch the chair. Then what I'm going to do is bring my crutch to this side, put them together. If I had a handle, if I don't, just hold the other side and sit down like that, okay? Same thing. All right, so if I was walking towards, and I'll do it this way so you can see from this angle. All right. I'm gonna back up so I can feel the chair. I'm gonna move the crutch to this side. Both hands, I would hold the rail or the side here and sit down.